Internet peptides are more dangerous than people can imagine. First of all, I had a patient one time that had veered into internet peptides, and because they were cheaper. He thought he'd save him some money. And he also was telling me that when he was younger, he could not afford Air Jordans, but now he could. And so he went to order some special Air Jordans, and he had a shopping bot where it popped up that there were these knockoffs. He knew they were going to be fake, but they looked just like them. And he orders them. And these shoes arrived the same day that his internet peptide order arrived. And he opened up the shoes first. He looked at them, said, "These are trash." And he throws them in the trash can. Then he opens up his internet peptides, and he looks at that bottle, that glass bottle with the white powder, and he goes, "At least I could tell those shoes were trash. I have no idea what's in this bottle. They could be just like those shoes." And that really hit home. That bottle, you have no idea if it's sterile. There's no liability. There's nobody that you can sue if you have meningitis after you used it. And you don't know those peptides are stable. And that's the biggest thing here. Peptides need bonds that are stable, and that takes money to produce. So that peptide might be stable and sterile for 2 days. And then all you're looking at is just clear water, and you have no idea that you're just shooting up with nothing that's doing anything for you because the bonds are broken down.
Well, so we deal with hormones a lot here, and a lot of times I hear from both men and women that they're waiting till later to start hormones. What are your thoughts around that?
Then they're going to be behind the 8 ball on that one. The symptoms are not going to show up until well into perimenopause to menopause. So your levels, if you're a woman, are going to start going down much or years before you stop having your cycles, years before. And as women lose testosterone, that's when they start putting on fat. You see women, you can tell when they go through menopause, it's because that's when they start adding fat. How their mood is, that's going to be dependent on estrogen and progesterone. And progesterone is just wonderful for better mood, better sleep, better REM lengths. And a woman who's better rested is going to take more steps the next day. She's going to have more energy. Testosterone. Without testosterone, there's no way a woman can put on muscle mass, and muscle's what burns fat. And then there's also libido. I mean, too many women get to menopause and they find that they're never interested in their partners anymore. And at what age do you not want to be interested in your partner? I mean, you can any age. Yeah, exactly. Men have this is trickier with men because while women have menopause and they really slam to a dead stop with their ovaries shutting down, men begin losing testosterone levels around the age of 22 or 25. That's when men peak. So it's this gradual decay of their testosterone levels. That's like letting air slowly out of the tires. By the time a man is 50, he has lost half of his testosterone level that he had when he was in his 20s. You can drive a Maserati with the tires half inflated. It'll drive, but it's not going to perform. So, for men, they can start young too because by definition, they're nowhere near where they were in their 20s.
Would you say there's starting too late? Like, is someone too far gone?
No. And studies that were done in the past that talked about that were not using bioidentical human hormones. They were using synthetic hormones that were fraught with problems. They were using horse urine. Premarin is nothing but pregnant mare urine. They named it after what it is. It's from horse urine. Now, those did cause problems, and they did cause problems, especially in women who were well past menopause, but that is not the case with bioidentical hormones.
What would you say are a lot of other key benefits that aren't getting enough credit?
When I first started, that's what I thought I was going to hear about when I saw patients back after getting them started. What I tended to hear from the vast majority of what I call producers, people who own their own companies, artists, professionals, was how much more productive they were, how much more focused. One of my fraternity brothers is an attorney, and he told me, he said, "George, it's like I'm reading legal briefs as if I just got out of law school, and I'm 60 years old." But I would hear that from more and more people about how much more focused and productive and sharp they had become.